hygienist practicing universal precautions to minimize any potential harms and risks is confronted with a patient recently diagnosed with HIV and hepatitis C. She is faced with the decision to treat or not to treat the patient. Additional issues include being the only dental hygienist in the office. Ethical core values associated with this conflict include societal trust, potential confidentiality, autonomy, and veracity. It's 11:20 a.m., and the third patient of the day has arrived for their 6-month recall appointment.
Hi, how are you?
Good, how are you?
Good. My name's Johnny, and I have an appointment for 12 o'clock.
Okay. Do you mind just filling this out? And Chris Murray will be right with you in a few minutes. You just take a seat. She'll be right with you.
Mr. Lopiano, are you ready for your appointment today?
Yes.
Johnny slowly moves in the waiting room. Slowly, his skin tinged yellow, with sunken cheeks, evident of exhaustion. Upon being seated in the operatory, the hygienist reviews Johnny's medical history.
Wow, it looks like you have lost a lot of weight. Has there been any changes in your medical history?
Yeah, I lost about 30 pounds. I've been having some cocktails. Not your typical ones, more like drug cocktails. I actually just got diagnosed with hepatitis C and HIV.
I see
Yeah.
that you're taking a lot of medications here in your medical history.
Yeah, quite a few.
Alright, just give me 1 sec. I'll be right back, okay?
The hygienist leaves the room to analyze what she can do for the patient. Analyzing the health of her baby, she returns to the operatory with her decision.
Alright, Johnny, let's get started.
Oh, how far along are you?
I have 6 months.
Oh, wow.
Thank you. I'm just putting on some PPE, some gloves and masks before I go in your mouth.
So a lot of gloves and masks.
Yeah, just to protect myself, you know. So I'm gonna hit you down and a little bit back. You can just put this on first. Right, if you mind just opening up just a little bit. And open. Everything looks good, Johnny. Thank you. You can close. Open you up.
We're done?
Yes, we're all done for today.
The hygienist decides that the health of her child is more important than the risk of treating the patient.
Mr. Lopiano, are you ready for your appointment today?
Yes.
How are you today?
Great.
Thank you. You can follow me. You can have a seat right here. Wow, it looks like you have lost a lot of weight. Has there been any changes in your medical history?
Yeah, I lost about 30 pounds. I've been having some cocktails. Not your typical ones, more like drug cocktails. I actually just got diagnosed with hepatitis C and HIV.
I see
Yeah.
that you're taking a lot of medications here in your medical history.
Yeah, quite a few.
Alright, just give me 1 sec. I'll be right back, okay?
I love carrots. Come in.
Hey, Doc. How are you today?
Good. How's it going?
Good. So, my patient Johnny just revealed that he has hepatitis C and HIV. Due to me being pregnant, I would rather not treat this patient. Is there any possible way that you can treat him for me today?
I suppose I can make an exception. It's a very busy office. You're my only hygienist.
Yeah, I understand.
And I hired you to do your duties. But I guess I can make an exception this time. Put him in my book next week.
Thank you so much. Hey, Johnny. So, due to your condition, we're gonna have to reschedule your appointment for next week so the doctor can better treat you. Are you available to come in next week around the same time or any time that you prefer to come in?
Sure.
What time works best for you?
Around this time?
Okay, so I'll give you an appointment card so you can come next week. Mr. Del Piano, you ready for your appointment today?
Yes.
How are you today?
Great.
Thank you. You can follow me. You can have a seat right here. Wow, looks like you have lost a lot of weight. Has there been any changes in your medical history?
Yeah, I lost about 30 pounds. I've been having some cocktails. Not your typical ones. More like drug cocktails. I actually just got diagnosed with hepatitis C and HIV.
I see
Yeah.
that you're taking a lot of medications here in your medical history.
Yeah, quite a few.
I'm also sorry to hear that. Do you happen to have the number of your primary care physician so I can give them a call to see if there are any contraindications for treatment today?
The patient consents. He digs through his wallet, eventually passing the dental hygienist a card with the contact information for his physician.
Thank you very much. Just give me 1 second while I make a phone call, okay?
The hygienist leaves the operatory, closes the door in the break room, and makes the call to verify that all levels are okay and the patient can be treated.
Johnny, you're all clear for treatment today. I'm gonna give you some fluorohexidine so you can rinse for me, and then we can begin.
The hygienist prepares the patient for treatment under standard precautions, following the ADHA Code of Ethics.
And you can put this on for me. There we go. Now I'm gonna bring you down and then back, okay?
The ethical position chosen is to treat the patient under strict standard precautions. Prior to treatment, the patient's physician should be contacted regarding blood count and bleeding risks, dosage of antiretrovirals, and disease and treatment stages.